Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of the Kidney Coach and of Kygenesis, a range of supplements that we developed for people diagnosed with chronic kidney disease who want to improve their eGFR and decrease their creatinine levels. And I'm joined again today by the amazing, beautiful, wonderful Dr. Robin Rose. Dr. Robin Rose is a Hawaiian medical doctor. She's specialized, she's got a specialized interest in primary care, but especially in nephrology. She received her family medical training in Santa Rosa in California back in the 1990s. And then after a personal scare of kidney disease, she totally changed her practice around and focused and has a passion for people who suffer from chronic kidney disease. So she has a very strong base and root in traditional medicine, naturopathy. She is gone down the rabbit hole, and I will let her show everybody the amazing book that she's written in kidney disease, and it's a great big hefty text. So Robin is no stranger to going down the rabbit hole, researching, and in kidney disease because she's had her own journey with it. So she really walks the talk and has really embodied all the things that really works about reversing and changing chronic kidney disease. And it's interesting, Dr. Rosa had a comment on Facebook this morning. You can't cure and reverse chronic kidney disease. And I'm like, yes, you can. And I'm talking some. But let's start. And we're going to do this lovely series on bioregulators. And Dr. Rosa is quite the expert on the bioregulators. And she's done some one-on-one training with Dr. Kavish, and rest his soul in peace, his wife. So she's very well versed on this, probably more than anyone else I know. But first off, I love this word Renology that you use. Tell me about that, because when you explained it to me earlier, it is such a fabulous play and change of how we view chronic kidney disease that's incurable. So first off, tell me about why you've really embodied that term, and I think even called your book that.
Indeed. Well, who wants to be failure? That's a really unpleasant. Something just fell next to me. Everybody with kidney decline is approached with, you have kidney failure, even if it's mild. And I was very fortunate. My integrative oncologist, sidebar, the way I got invited to the kidney club was with a kidney tumor and a nephrectomy. She was very fierce about this. Don't use the term failure. You're not in failure. So she planted seeds early on. I mean, I was pretty much in another planet in the process of healing from that. But that stayed with me. And, in my own work, I started looking at, where did this start? It doesn't just, the dharma of GFR greater than 60 is normal stuck with me for a long time. I mean, I'm sitting here in the beautiful tropics pondering, why do we wait so long? And I have lots of reasons. I understand it to some extent. Medical, economic, politics is a big one. And so I really, for my own benefit, had to find another way to describe this. So the nephrology community was starting to say, nobody knows what the word renal means, so we're not going to use it anymore. And I was like, cool, I'll take it. And so I did. And I coined this term Renology, which is the art and clinical science of kidney success.
I love
Try
it.
that hat on. It's a much more positive, life affirming, yes, you can reverse this position. And I'm primary care. So it's a really different place in kidney medicine. People come in with a mild, I don't feel good. You don't know what they have. This could be pancreas. It could be some brain thing, blah, blah, blah. It could be anything. And so, first of all, my passion evolved that Renology is really about early kidney, where the decline of chemical pathways can very easily be reversed. I mean, it's a no-brainer. And yet, what I see in conventional medicine is that's normal, don't worry about it. And so, if you think about it, if all you use is pharmaceuticals, and the pharmaceuticals have consequences, you want to wait to use them. I mean, that to their credit, that's done. To fault, though, is that, so what else do you have to offer? Nothing. Okay. I mean, I had that experience myself. And so ultimately, you and I, as physicians, have many other things to offer. And so if somebody's in decline, okay, you want to treat their blood pressure. If they're seeing an allopath, maybe they're taking allopathic meds. There's so many other ways to approach it. But, what I see is cholesterol, diabetes, and high blood pressure medicine in stage 2. And there's so much that's going on. I mean, we were just talking about this before we started to record. I've just cataloged basically the chemistry of stage 2. It's all of what happens as it proceeds, but these are things we know about: dysbiosis and endothelial dysfunction and mitochondrial changes, insulin resistance. We know. So we have so many ways to go about this. And so that was what I just knocked you over. I'm knocked over by knowing this. I mean, I just had a conversation with a local Hawaiian man who's about to be on dialysis, and he's just finally coming to see me, talk to me. Years ago, he saw a doctor who said, "You have high blood sugar." That was it. Come back later. Okay, he came back later. "You have higher blood sugar." Nothing. Okay. He came back later. "You have diabetes. Here's your drug."
Oh.
And he realized in our conversation how absolutely appalling and sad that is. And that's not uncommon. So Renology is really taking all those vicious cycles. If you have high blood pressure, it could turn into kidney. They go round and round. Where do you start? Turn those vicious cycles into precious cycles. And then we're liberated from the fear and, the I don't know what to call it. The meme is expect to decline.
Yes, it really is. That's exactly right.
I was told that, do not be surprised if you lose 5% a year. I was at a GFR of 30. That's 25% function. I had to do a little Jersey girl and get fierce and be willing. And that's really a big part of it, is to be willing to tell yourself, I can do this. I don't have to eat stuff that's bad for me. I need to exercise. I don't feel like it. I'm going to do it anyway. It's like a whole inner dialogue. It's a spiritual practice, really. And so Renology embraces all of that. Self-love, it's the first step. Willingness, time in nature, enjoying your life, sleeping well, drinking plenty of fluids, blah, blah, blah. We know all these things. And then I discovered peptides. And that was an amazing, oh my God. And then I discovered bioregulators. And I was very fortunate. I reached out to Marios Kuriezis, who's written a very beautiful little lay book, very simple, which really helped me. And in that book is a case of someone who was about to start dialysis, and he put him on Pielotax, which is a bioregulator peptide. And the man reverted to what the allopaths think of as normal, GFR 60. That's still not normal in Renology terms, but wow. And I can tell you the difference between a GFR of 30 and I'm now at 68 with one kidney. blessed be, major difference in absolutely every aspect of life, you know. And so what I found out with bioregulators is they actually are tiny. They're little teeny pieces of proteins. I mean, you know, proteins are these big, complicated, wound up things, and peptides are a little piece of that. Bioregulators are even smaller. Generally, the way you say it is, you know, 2 to 4 amino acids. Some of them are bigger. The idea of a bioregulator is that they can get through the cell membrane without needing a receptor. So it's easier chemistry. They just, you know, need a hand. Here, come on in with a transporter. And then they can actually do the same thing, get into the nucleus, which this is a skill set that not all peptides, not all chemicals have. The coolest thing about them is that they can lodge in the DNA. So here's a little sidebar. Epigenetics means we come with a program of genetics. Life can damage those things. Chemicals, infections, stresses, you know, war, all kinds of things can happen that alters the expression of these genes. And what that means is the genes make proteins that our bodies need to thrive. Without those proteins, bad things happen. And that's a real utterly simple way of saying that. So
Brilliant.
along comes the bioregulator, lodges in the DNA, each one, and there's many of them, you know, different organ systems. They basically are natural extracts the body recognizes as self, which means there's no side effects. It's amazing. I mean, there's some reactions people can have, but basically, you know, the Russians have seen 2 million patients in their clinic. They don't have side effects. So they get in there, and each one a little different, works with histones, and you know, each one's shaped a little different, so they lodge in the DNA in their own way. And then magic happens, and it actually is able to reverse the epigenetic changes, and the proteins happen again. It's not like, you know, if you take an aspirin and your headache goes away, bingo. You know, that's the modern world. I want it now. These things, these epigenetic changes generally take time to evolve. I say it's like, you know, I live looking at the ocean. You see a little boat, it turns around. A big ship takes a while. And so the bioregulators take a while to start rearranging. It's like the garden, building up the soil. Then you got to, you know, mulch it. And then you got to add the seeds and water. And so in time, all of a sudden, and most people tell me this, myself included, oh, things feel better. I
Mm.
mean, it's really quite impressive. And so I'm in love with these. And I'll do
And
this now just because I
yes,
can.
do it now. Look at this beautiful
Look at
book.
this
I love
gorgeous book. The artwork is so exquisite. It's I wanted these DNA bodies, and a Ukrainian artist who unfortunately is having to live in Poland did this artwork. It was absolutely pleasing. And the book is really reflection of me as a blabbermouth, because I really couldn't simply say, here's the bioregulators. Well, you got to know a whole lot about kidneys. So really, I've made it into 3 sections. The first section is there's a lot going on that most people don't learn. Your patients probably hear all this, but we're all still learning the
Mm.
effects. What in the world and how is it that nephrons decline? And the irony of it all is the tubules, this part of my stage 2 is not normal conversation. The tubules decline. So you may have a normal creatinine, you may have normal BUN, and even what some people consider a normal GFR in stage 2, and still be having a lot of damage because the tubules are like the Raja Yoga of the body.
Yeah.
It's kind of interesting because, you know, discernment is how we survive in life, deciding what's okay, what isn't okay. The tubules decide what to keep and what to excrete. And a lot of influences affect that. And that's something that I've been learning, some new testing, urine testing that can show early tubule decline. And that's part of this presentation that I will definitely share with you.
Yeah,
And
thank you.
I am laughing because I literally, excuse me, I have to let this annoying dog out. Sorry, you guys, real life in the jungle. She has to lick the bowl of the other dog or she will have a conniption. Excuse me. Utterly professional here. Anyway, so the tubules are amazing to me. I've just spent a couple of weeks looking at them. And so that's our next frontier is catching people even earlier because the labs we have really aren't that adequate. And no wonder they're saying, it's normal because we don't have a way to say that it isn't.
Yeah.
And, and so what I like about bioregulators is they're really able to hone electrically and chemically to abnormal tissues. They even work better in elders where there's been more damage. I think it's just amazing, and so, with that in mind, we can really be pretty liberal on top of everything else. I heard Professor Havenson, the man who discovered all these, say in a lecture that you can't use these and not observe the laws of the universe. Like you have to sleep, you have to eat right, you have to think right, drink your fluids, do your exercise, meditate. All these things are not optional. And then bioregulators like cherry on the top. And with kidney, there's absolutely no excuse. I have plenty of them. I deal with them all the time. We all do. You don't have to be perfect. And that was the thing that I tried to do at first. I was scared. I was like obscenely obsessed about it. And in fact, it helped. And so here's part of why reversal is the goal is because I have a lot more freedom to live my life now.
Yeah, I love that. And that's, isn't that the ultimate aim of life and human life expression? And I think that's what I also love about peptides and bioregulators, that they're so simple, yet so effective. And they are the way that they work on gene expression and epigenetics. And just like you said, that being able to enjoy and love life again when you water them in and do all the stuff that you spoke about, like hydration and eating well and meditation. That's like the watering them in so they can really embed themselves and bloom. So you can maybe have, the ability to enjoy life a bit more. But take me down the rabbit hole of Pielotax. So that is and you talked about in that book, and I'm laughing because I'm pretty sure this book is sitting on my shelf here somewhere, just on the side there. But when people think about bioregulators in kidney, and there are so many, and we're going to do a whole series on this because I think bioregulators, for people who are scared about big interventions or a lot on pharmaceuticals, bioregulators are a lovely thing to add in because of their lack of side effects and interactions. But the first one that I think most people would think about is Pielotax because it's particular affinity for the kidney. So Dr. Rose, you are the expert on the bioregulators as far as I'm concerned. Walk me through Pielotax and everything that a kidney patient and a physician might need to know about this amazing bioregulator.
So the first thing to know is historically, we have used extracts and glandulars.
Yes.
There's long history. Think about this as taking that to the next level. So they have many chemicals as part of the conglomeration that would be a glandular. These are purified. There's an alkaline process that is used to cleanse infections and other chemicals away. So, first to know there's the synthetic ones, and then there's the more natural ones. They both have a place. The synthetic ones actually are identical to our body, so it's not like, oh, they're, there are people who are very vegan, and so they have that option. The other ones come from animals that are very well tested. And that's a place where you really do have to be careful where you're getting these from. If they're very cheap, be suspicious. There might be chemicals, heavy metals, infections, these like mad cow kind of infections. The responsible producers of these are very cautious about this for every good reason. And so they're extracted from the kidneys of either pigs or cows that have been grown specifically for this purpose. And they have the ability to hone to the specific tissues from which they have been gleaned. So in other words, the brain bioregulator generally, and there are some exceptions, and the body cells all talk to each other, so that's a big exception, but generally they have done a lot of research. The second section of this book, by the way, is looking at all of this, the questions about it, how it's produced, what they do, blah, blah, blah. It's worth knowing. For a clinician, it's really worth knowing, and it's interesting. And so the natural ones tend to have a little bit more like nucleic acids and minerals and vitamins hooked up, so they last a little longer. And so Pielotax from these animals that are clean, and I keep repeating that because if you have kidney issues, you don't want infections, you don't want heavy metals. Caution is worth a lot. And so ultimately, they hone to the kidney and are able to attend to a variety of things, whether it's tubular, glomerular, there's, anti-fibrotic benefits to it. And so, right away, that and their role as antioxidants is a huge conversation because, when things start being oxidizing, I mean, think of it as rusting. It's a simple way to look at it. And then inflammation happens and it gets swollen. Then what happens? It scars up. And there's scarring that can happen in the tubules, in the glomerulus, in the area around those, in the blood vessels. And all of that makes a difference. And I just want to do a sidebar is generally, if you think about a kidney, there's a lot of different tissues. There's cartilage, there's blood vessels, there's nerves. There's kidney itself, the epithelium. And so all of those tissues can be addressed with different bioregulators. The Pielotax is kind of like the choir master. And I've found for self and others, using it for a prolonged period of time is useful. Often, the advice is use a bioregulator for 10 days, a month, sometimes a month, and then every 3 months. I've found with a case where there's enough going on with kidney that you care. Like, oh, I noticed my GFR 70. Let's do some lifestyle stuff. I might even use Pielotax in that case. But, especially slightly more advanced long term.
Yeah.
Apparently there is not, and I'm a living example. I'm probably doing it for 2 to 3 years now, almost constantly. And so they bundle, as they call them, nicely with things like the blood vessel bioregulator, the parathyroid bioregulator. Why? Because phosphorus and calcium gets messed up, and then the bones and the blood vessels get messed up. Okay, these are things we know. The brain is affected. Cycle that. The eyes. I was alarmed to have very rapid cataracts form when I was really sick with kidney disease. There's reason to step in earlier than I did. By the time I found out some of this stuff, I was like, this is the book I needed. I just didn't have it soon enough. And so, when I'm looking at my section on Pielotax, what to use it in, all varieties of CKD. I was asked by one of the nephrologists who's functional, like, well, what part of the kidney is it from? I think it's just generalized glandular that synergizes. So it will hone to all of these tissues. I mean, I have written here hypertension, diabetes, lupus with renotoxic medications, oncology cases, vascular disease, and again, geroprotective. A lot of the work that's been done around the bioregulators is about longevity. But
Yeah.
I have a different perspective about this. I think that longevity is interfered with by illness.
100%. I agree with you there.
Right. So longevity to me is treating abnormalities. I'm back to what I actually started out doing, and not always, some people are very healthy and they want to keep it that way. A little bit different conversation. I talked to someone earlier today who has no problems, 50-year-old in good shape. Somehow the universe called her to do a fibro scan, and she has 3 out of 4 markers for liver fibrosis. She was fine. Okay, so we're going to do some stuff and look to reverse that. That's a really wise thing to do. I've loved that kind of care in my primary care office. It's fun. I mean, it's like you're doing good. Let's do even better.
Yeah.
But remember, kidney disease is a progeric illness. I love that word. Progeria. I mean, have you seen those pictures of like some 13-year-old who looks like some old 100-year-old?
Yes.
That's
Yes. Yes.
progeria. It's alarming. And when I learned that CKD is a progeric illness, it was like, oh, okay, what do I do for anti-aging? Because anti-aging means dealing with the complications of this illness to prevent this accelerated aging that none of us really want. And that's another gorgeous role. I mean, just gorgeous for the bioregulators. It's so fun. And so there's been lots of studies that Robinson did a study on gout nephropathy.
You're right.
And and so let's see, he had 42 patients. It was a small study. They were experiencing joint pain and inflammation. And as we know, kidney disease can trigger uric acid to go up just because there's dysbiosis and uremia. And so it's worth getting a uric acid level, by the way. All of their patients had their usual meds. So, if they were being treated by allopathy, they probably got allopurinol. And then they were given 1 or 2 capsules 3 times a day for a month.
Your dose. Okay.
Okay, so that's where in the book I say clinician to decide dosing. Generally, you're safe with doing 2 caps a day. Anybody can do that. Protect whatever you got in this toxic world, you can protect it. But when there's pathology, and I've learned this from Dr. Greenberg, who does a lot of TID dosing 3 times a day of peptides. And so it's something that I'll do when somebody's really acutely ill, have them up the frequency of the dosing for a period of time, because then you cycle them. So you might do a month and then wait a month and then do 10 to 15 days. That is, if you want to stop. If you don't want to stop, listen. I'm really into like listening to the messages. Like, why did that woman go get the fibro scan?
Yeah.
That was really interesting. It's like, oh, I mean, I got a bottle of bicarb tablets just that way. I went to a thrift store and it was like, God told me you need to take these. Okay, I'll do this. I mean, there's messages that we have. Listen, and I really listen. So, the Pielotax conversation is just a no-brainer. No matter what, monitor your labs. You know, I mean, when I started using these, my GFR was 51. Then all of a sudden it was 60.
Mhm.
Like, I did a happy dance. Then the last two times I've checked was 68. I haven't checked in a while. It's like, I'm good.
Yeah.
I'm in
For
stage 2. That's normal, right? I mean, I'm very
sure.
aware that, there's still plenty going on. And it humbles me to watch my diet. When I go out to eat, I am careful. When I go to other people's houses, I bring my own food usually. Try not to be too insulting, but it's like, I'm sorry, I'm really picky. And and so yeah, I mean, ask me something because I'm not quite sure where to go with all of
No,
that.
this is brilliant. And I guess this conversation was really about the Pielotax. So I guess the big things that people want to know is, and we've sort of covered it gently, but interactions with other medications. Is that something you have to worry specifically about Pielotax or any of the other bioregulators?
Apparently not. In fact, I've more often read it enhances the benefits of meds, which is
Yes, I've
really
heard.
comforting. I mean, that's true with some botanicals as well. A lot
Yes.
of the herbal medicines will actually enhance the benefits. I mean, if you think about it, a medication is sort of like it has one thing in mind.
Yeah.
And a lot of these more natural things kind of take care of the array around it. So, it's kind of a community effort. I mean, if you
Yeah.
think about it, I mean, the body's making cytokines. It may even be making cytokines in response to the medicine.
Yes.
Like it said, I mean, there's drugs that are harmful to kidney. I mean, even ACE inhibitors, which we use
Mhm.
liberally, can be can be harmful in the kidney enough that putting something in like this can really obviate some of the harm. And so many things. I mean, so much in our food supply is harmful to kidney. So there's really, in my mind, especially in a CKD person,
Yeah.
no
They
reason.
almost like taking enzymes when you've got like a sensitivity and people do that. It's almost like taking your bioregulators as a insurance against further damage from things that you may or may not be aware of. So that's the side effects. Then I was going to ask you, I think people want to know about dosage. So you covered sort of a bigger dose, and I know the regular dose is sort of 1 capsule morning, 1 capsule night, but you've mentioned there a bigger dose. Do you have a protocol or a go-to? Is that something you very much decide one-on-one individually as you're working with a patient?
So here's what I say in the book: just 10 milligram capsules, take 2 by mouth, that's 20 milligrams, daily or twice daily for 10 to 30 days. You got some play in the wheel. When somebody's much sicker, go to 3 times a day. You cycle as indicated by clinical status. So I mostly am saying clinician discretion.
Yeah.
Sometimes we have to be our own clinicians. That biohack aspect. You got to know what you're doing, but because there's a lack of good guidance, people are making choices. And so, I'm comfortable with these as a result of that, because there's really few things that can happen that go wrong.
And that would be the next question, side effects. So, I mean, I've been using them really since we sort of started to have the conversation about bioregulators, and I've never seen a reaction I have with peptides, but not with bioregulators. Are
Correct.
there, and you mentioned with some people, there are some things that happen. Tell people about that. Is there anything that people might need to look out for with Pielotax in particular?
No, I like you. I haven't seen anything
Mm.
that was of concern. And from talking to Dr. Trofimova, I mean, same.
Mm-hmm.
It's it's kind of mind-boggling. How is this possible? It's like, and
Yeah.
and that's not to say like, okay, I have concern for people who I'm doing a mind blank, who can't eat beef. That
Oh, right. Yeah, I know. Yes. And Lyme disease and things like that, where people become that super sensitive to meat and all of those kind of things.
and so I'm totally doing a blank on this. Sorry. Um, I have one young adult who has that abnormality. And so, no problem. We go to the synthetics.
Mm.
Not a problem. They're harder to come by. Some of them are harder to find. They can be injected, whereas the other ones cannot. And some people prefer that.
Mhm.
One of the interesting things when I first started, I couldn't swallow all these pills. And
Mhm.
Bill Lawrence just said, dump them in a smoothie.
Yeah.
So I actually use them. I have two elder dogs. I I dump them on their food.
Yep. That's how I do my boys as well. KPV and bioregulators all mixed up in his food. I'm looking at
Yep.
him right now.
Yeah, I
And
mean,
then,
we had a very sick cat, and I was preparing that he was going to die. And I live in Timbuktu. We don't have a veterinarian. I mean, you can do an expensive flight and go to another island to get vet care, but we kind of cowboy it here. And so I said, give him some BPC. The little
yeah.
dude got better. He's fine. He's sitting here listening.
Oh, that was him before I met. There you go. Yeah,
Yeah, I
they're
kicked him out of my chair here.
okay. And pregnancy, totally safe if you're pregnant. I mean, they're my go-to if people are pregnant and I have to take them off some of the things.
I'm unsettled about that. I generally say don't do bioregulators, pregnancy and nursing.
Okay.
There's probably that would be a good question for the Russians who, by the way,
Hmm.
may be working on an English language training, which would be nice. Um, and so, that's an unfortunate situation. I might think otherwise. If I learn from them that they've done that in a severe situation. I
Yeah.
mean, we
Okay.
always do stuff, I mean, come on, we do surgery. You slice somebody open to achieve something. It's kind of brutal, so uh, you don't want to inflict damage if you can avoid it, but sometimes you just have to, you have.
Yes. Exactly. And brands, you mentioned brands before, and that is a big thing because traditionally, really, my understanding, and I know it's in your book, so definitely correct me if I'm wrong, there is a very specific procedure method that these go through to get clean. And people are often surprised how expensive the bioregulators are. They are not cheap, and that's because of all this process that they go through.
Yeah.
Um, and I know, and again, tell me if I'm wrong, Nature's Marvel seems to be the brand that I tend to go for. And then there is the Russian brand, which will be in Pielotax and things like that. And they're the two that I just use and nothing else. But are there any other brands that you feel confident and safe with, or are those brands ones that you're okay with?
That's basically what I've been using. I mean, I have been liking integrative peptides, thymogen alpha 1.
I do like that one too. I forgot about integrative. And yes, yeah.
Now, one thing that I've learned from Phil Mikens is that some of the newer products are actually extracts and not bioregulators. And so I'd like to just, we talked about this before we started, to address that a peptide actually needs a receptor to get invited in. And they're generally bigger. And so they get digested into a bunch of little pieces if you do them orally. BPC can be oral. KPV can be oral because they're small. Well, BPC can be oral because it comes from the stomach, so the stomach doesn't get upset about it being there. Although it's better to use it injectably for systemic issues. So I think it's a little yes and no. But the bioregulators are tolerated because they're already in the small piece that the stomach would have taken care of, and then proceeds to go down. And they have unique transporters. I wrote a lot about the transporters. It's fascinating. And I was just looking at somebody in the peptide doc group brought up about a leucine product. And I looked this up because the body deals with things differently. So an amino acid has a different escort service than a peptide, which there's a bond between those two. And there's something about that chemistry of the bond that empowers that molecule in a different way than if you just have the amino acid. If you had two of the amino acids, it would be a different experience. And, you know, there are peptides that get into the nucleus, but not like these bioregulators. And so this was another Phil Mikens, who is the Nature's Marvels genius and wrote a book with Professor Hobinson. Not all small peptides are bioregulators.
No.
So they have a role and they do stuff, but not that one. You know, not the DNA thing, which is stunning, you know, and then you have benefits for getting rid of senescent cells and, you know, the whole inflammatory oxidative fibrosis thing gets addressed in ways that, you know, I mean, you can use the thymus injectables and get amazing results. I also see that with the thymogen alpha-1 is 2 thymus peptides, and Vylon is only 2 amino acids, and it's gorgeous. And it goes, you know, these things all work well. You bundle them. They actually work nicely together. And there's a company coming from out of the Russian community that they're doing bundles. And I want to look into it. The woman who's teaching with Dr. Trofimova is promoting these, and I asked her, you know, so is there any like titanium in these, or are there any toxic things? And she's like, we don't have that in there. So it's interesting because they sound very expensive, but when you look at it, there's 3 in 1. So it'll be the bundle for liver, or it'll be the bundle for brain. There's a
I've
men's
seen
bundle.
some of these. Yes. Yeah.
And so you know, I'm going to look into that, and for everybody listening, I am evolving a website and want to have some of these resources there because, you know, it's the same question. Where do I get them? And there are brands that are out there now that I'm not willing to promote because I don't really know. They're not being transparent enough for me to feel comfortable recommending it. You know, and if I won't take it because I don't know, I don't want you to take it either.
Yeah, no, there's a couple of peptide brands I feel like that about. And you sort of half answered this, but I think the other question is some people will say to me, look, I can't afford the bioregulators. Can I just take glandulars? Which is, I think back, you sort of talked to this, you know, can I just take the thymus gland, or can I eat more kidney and things like that? And I think it's going to come back to this, the ability to cross and into the cell nucleus. But is that something that people could do? Like, can we just take glands and not worry specifically about the bioregulators? And what advantage do the bioregulators have over a straight glandular?
I don't think that glandulars work in the same way as a bioregulator. I mean, they have a role. I mean, I used to use a lot of glandulars in my practice, and I don't anymore. You know, it's like, you know, I just got a Carmen. You know, I just got an upgrade, and so this is so helpful. But I don't think it's bad. I addressed it in the book at one point where it just isn't the same. And I also don't think it's a bad thing. I mean, we feed our dogs, you know, liver and kidney and heart that we get from the butcher. And, you know, I think that there's benefits to it. You know, not everybody wants to be eating all these animals. And so, you know, this makes it a little bit simpler. I mean, and with kidney disease, you know, I am a proponent of be cautious with animal food.
Yes.
You know, it doesn't mean never, but not so much. You know, and that's another part of the willingness that I'm always addressing. You know, it's like if I'm willing to do it, I'll do it. And you know, and so you know, if you eat an inflammatory diet, will Pielotax make the difference? It probably will help. But again, the low-hanging fruit is obligatory. It's free medical care. You just have to do it.
Yeah, I say this about our supplements all the time. People are like, that didn't work. I'm like, well, are you eating an alkaline diet? Are you meditating, exercising, you reducing stress? No. Well, no, like these are add-ons to, removing the cause, taking away all the stuff that's driving the disease in the first place. You can't go along with your foot on the accelerator and the brake at the same time. You're going to blow smoke out the back of your engine. So yes,
that's an allopathic way of looking at it. I mean, and this brings up, I remember a patient of mine long, 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 long decades ago that I probably gave a statin for cholesterol. And she came back and said, great, now I can eat whatever I want.
Oh, wow. Yeah.
And that was like, I need to create a dialogue here. I mean, she wasn't ever somebody who changed, but how I addressed all of this did. And so the culture thinks that, you take a pill, everything's fine. Next. And it never is. I mean, it truly never is. And so, I'm kind of celebrating that we have somebody in the American government starting to talk about all the chemicals in the food and, blah, 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 because until our culture celebrates really doing what's right, happy, healthy, holy, people are still going to be sick, and they can take all the pills they want. There's still going to be stuff. So.
Couldn't agree with you more there, Dr. Rose. So what wraps up our conversation, Pielotax? Is there anything else you want to add about this amazing bioregulator before I return you back to that gorgeous environment that you're in and the wild over there in Hawaii?
Well, I'll show you the cover of this book again because I love it so much.
And I'll put a link in the show notes so people can buy it, so people can have a look at that as well, to your website.
The website is Renology is kidneysuccess.com. Keep saying that over and over again. Kidney success.
New mantra. Yeah.
Because, this interview will end up on there, and I'm trying to just get more agile with just blip. I wrote one on saffron, on cardamom, on coffee. Just idle thoughts come, and I'm happy to do that. And so all of these things matter. It all is a synergy of the attitude, the presence in nature, relationships. I mean, all that, and then the Pielotax and the bioregulators will just float it. It's really empowering.
Yeah. Thank you as always for your wisdom, your time, and being such a pioneer. And whether we decide the journeys we're going to go on or not, but the journey that you've been on and turning your, diagnosis into triumph and then being able to help others. I think that's the greatest gift that we can ever do with things that we're given. So thank you for being an angel on the earth to do that. If you want to know more about the beautiful Dr. Robin Rose, again, I'll put all her links in there, including where you can buy the book and her website. She is writing blogs on there all the time and articles that you can go and have a look at. And if there's any comments that you want to ask, put them in the comments below and I will definitely pass them on. Dr. Robin Rose and I plan to do a series on the bioregulators and going through. There's so many that I want to pick her brain about that. Some things you don't even know are bioregulators like carnosine, and it's one that we might have a good discussion about next time. So I think it's an underutilized product.
Carnosine, tune in for that. It's blown me away.
I noticed in the Facebook group. I'm like, I'm to get onto this.
I'm like, oh my God, it does this too. And what about?
Yeah.
I had some guests, very prominent, the ozone teachers, and I cook and iron. I love my iron cookware. Oh, they're like. And so I looked it up and I'm like, look at this. Carnosine actually eliminates the danger of iron in the body. Thank you. So now he's taking carnosine.
I love it. That's so good.
So,
Well,
yeah,
you're a
I wrote
joy
some.
as always, Dr. Rose. So, yeah, make sure you tune in next time. Anyone wants to know more about what we do, head to www.kidneycoach.com. You'll find us on all the social media and Facebook and Instagram. And I don't even know if we're on X, but with Kidney Coach after it. Make sure you hit subscribe and like. That time you will get notified anytime we put up new content, especially the new Bio-Regulator series that Dr. Rose and I will undertake. Thank you for being part of our community. We'll see you all next time, Dr. Rose. Thank you again. Bye.
Thank you. Thanks, everybody.